Hi everybody, welcome to Shebesh Speaks on mental health. Thank you for joining me on my YouTube channel. This is something new that I am doing, and I am doing it because of the mental health status in this country and all over the world. I suffer from bipolar disorder. I am excited to be speaking today on bipolar disorder because a few of the conversations I've had in the last probably few weeks, I've noticed that people have responded to me, people have asked questions, and there is stigma around mental health. And therefore I'm here to create a platform for those who suffer from mental health, especially those who suffer from bipolar disorder, which I do. And today being the first day of having this conversation, I will just introduce what bipolar disorder is to me, and what I've gone through, what I think has helped, what I think needs to be done, and how I think you can interact with your mental health issues or those of your family or friends. So let me say that when I was diagnosed with bipolar disorder, I am not the one who realized I had a problem. It was my husband. So first of all, people with bipolar disorder may not realize that you have any issue. In fact, you just think that you're moving through life either very manic, which means very excited and very active, or you're going through life through depression, which is being low and sad. And until you get the diagnosis, you will not know that you are suffering from bipolar disorder. So again, I speak to you telling you that I have bipolar disorder, a disorder that was recognized by my husband, not by myself. And when he asked me to go see a doctor, I took it positively, and I did it immediately because I knew it came from a place of love and a place of concern. It's not that I had not noticed that I switch moods very quickly, which is what bipolar is. But I just didn't think there was anything wrong with that because I had seen other people also switching moods. But just to let you know what bipolar is a switch of moods from a manic state to a depressive state. Very high 1 minute, very low the next. Bipolar has two types, bipolar 1 and bipolar 2. I suffer from bipolar 2. Just also to say very quickly, I am not a psychiatrist or any form of doctor. You all know me. I'm a chief administrative secretary, and I have been a member of parliament, so you know I'm not a professional medic. But I am a survivor of bipolar. And that's why I'm saying that until and when it's diagnosed, you could live your life with bipolar, but on the way you will find that you find many confused states of yourself and those people who are around you. And so when I was diagnosed with bipolar disorder, of course I went through the rigorous process of getting a psychiatrist. And so I was saying on this, my channel, from the next episode, I will bring on the psychiatrists who I have around me, who have supported me. And I will also bring on board my psychotherapist who also has supported me. Bipolar disorder is a disease of the mind. Just like you can have diabetes, which is a disease of your sugar levels, or you can have hypertension. This message that I try to pass about bipolar being just a disease like any other is something I've struggled with explaining. But do you know the reason why people, when you tell them you have bipolar disorder versus telling them I have diabetes, have a problem? It's because bipolar and mental health has been stigmatized for too long. People believe, including people around me, believed that if you have bipolar disorder or mental health issue, you are either crazy, you are mad, you can't be helped, you have been bewitched. Bewitched is a big story, by the way, around your mental health. And there's something very wrong with you and nothing can be done. And nobody should touch you and everybody should walk and tiptoe around you. That is not true. Bipolar, when you go through this rigorous process of getting the right doctor, the one that you jail with, because I do believe there is a reason for jailing, and if you agree to continue with bipolar disorder through medication and psychotherapy, it's a double win. For very long, I did the medication, I didn't do the psychotherapy. Why didn't I do the psychotherapy? Because I was still fighting to understand why I have bipolar. It was like asking, why me? But because I got medication, I decided to take my medication, and of course it helped stabilize me. But I had not dealt with the emotional baggage, stress, and anxiety that I have that exacerbates my bipolar. So I got the right doctor, the right psychiatrist, and we were able to get the right medication after trial and error, I can tell you. I can tell you it's a trial and error. But I'm very happy that for about 6 years now, I have been on the same medication, which is working perfectly. So when you do go to see a psychiatrist and you have to change your medication, just be patient, because I think it happens in all other diseases. But when I finally agreed to see a psychotherapist, I learned to deal with my triggers. Now, triggers are the reason why bipolar spikes, either to be manic or to be depressed. And triggers are things that probably were in your childhood, or things that just make you uncomfortable for reasons you cannot understand. And that trigger takes you one way or another. My triggers have always taken me, more or less, into depression. When I was still taking alcohol, my triggers would take me to mania sometimes, because I was mixing that with alcohol. And so, you know, stopping to drink was a big thing for me, to be honest, and maybe I'll talk about that later in another episode. But just to say that when you go to the manic side or to the depressed side, it's where you cannot balance the mania, and it becomes excessive, and therefore can become careless and actually risky, and you can literally become bankrupt because you also overindulge in many things, including spending money where you don't have to spend it. When you go to depression, I always try to describe depression, especially for someone who has never gone through depression, as a wet blanket on you every single day, every single minute. The reason I am bipolar 2 is because I went through a depressive state that lasted a year plus. And in that year plus, I lost a lot. I was an elected member of this county of Nairobi as a women rep, and I wasn't able to work for a year plus because I was in depression. And therefore, when you go into the depressive state, for me that was my scary part. But for other people, it could be the manic state. I hope I'm sounding a bit clear, because I can be a bit erratic when I'm speaking, and I'm hoping that we are communicating. I will be looking at some of the comments for those of you who have joined me, and probably comment one or two. Thank you so much, Lydia and Consolata and Constance. Thank you, Fatuma, and the rest who are watching. For depression, as I was saying, it's a wet blanket over your whole existence. You lose interest in literally everything. At the same time, you can lose your appetite, or your appetite can increase. And getting out of depression, for me, the one that took me a year plus, is the reason why I decided I'm going to speak about mental health. So, as I said, in a month or so, a few weeks, I've been talking about mental health. The thing that I have gotten back that is amazing is, Paule, sorry, are you okay? God is with you. You shall make it. Those are the messages I'm getting, including phone calls. And thank you. Thank you for those who are asking me that question. Because for somebody in bipolar disorder, depression, it's sad. And it can be heavy. And it can tend to give you suicidal thoughts. It can tend to give you suicidal thoughts. And I'm not saying suicide for people to think I'm trying to be, I don't know, I'm extra. No. If you live in this country, you do know, you've heard, maybe you've been disturbed by the number of suicides that we are seeing, especially around the ages of our children. So it's a real thing. And once I overcame that 1 and something years, when I decided to start speaking about it, I did not have this platform that I have now. And the reason I've decided to go also to this platform of YouTube is because you can hear exactly what I'm saying and nobody will twist my words. Neither will anybody, infer something that I did not say. That's why I decided to go this way. And therefore, I'm here for you as somebody who is living with bipolar. I like saying there was a time bipolar was controlling me. Now I am living with bipolar. And bipolar doesn't control me anymore. However, without a support system that is solid, and I mean solid, from your family, immediate family, my husband, my children, my brother and my sisters and my mom, and my late dad, and friends around me. Friends who are as close as sisters to you, I have them. They're called hot mamas. They understand me perfectly. And in extension, I have brought on board those who work for me and with me, because it is important for me, for my work, that around me there are people who can help me stabilize because of the work that I am doing for this country. And lastly, even for my bosses, and I thank the President, Uhuru Kenyatta, and my Cabinet Secretary, Professor Margaret Kopia, because I've had this conversation also with them, and they are 100% supportive. In fact, the President did set up a mental health task force whose report is ready. We are looking forward to implementing what that task force said. But in our Ministry of Public Service and Gender, my Cabinet Secretary also set up a mental health unit for the public service of this country, because we're in charge of that. And therefore, support system is key. After you've gone through your diagnosis, and you accept, and I beg, accept your diagnosis, you will then go through probably some medication, and I ask you to go to psychotherapy faster than I did, because my psychotherapy is really assisting me with my triggers. So let me see what people are saying and see whether I can... Oh, let me speak about my sister, because I can see her here. My elder sister is called Betty. Yesterday she gave me permission to speak about her. My elder sister Betty is the firstborn in our family and is also diagnosed with bipolar. We have been on this journey together. She actually is the one at the end of the day who convinced me to see a psychotherapist. Betty at the time was on medication. She was able to do psychotherapy so well that she was able to get off her medication. I'm still a bit hesitant about getting off my medication. I still fear that I'm going to manage without it. So I'm in that journey, but thank you, Betty. Love you so much, and thank you for being always my strength around my mental health issues. Nita says it's good for you to come to the open about mental health and depression. Is real, very real, Nita. Thank you. I also want to talk about now that I'm reading comments, I want to talk about social media and cyberbullying. It's been a struggle for me to be on social media because, as I've told you, one of my triggers is always fear of rejection, where I feel I'm doing something and people are rejecting it. What I read into it is that they are rejecting me, and most of the time, no, it's not me they're rejecting. They could be rejecting just the idea that I was putting across. And the word no, for long, the word no triggered me. Again, it's not no to me. It is no to an idea. So that is a trigger situation whether I don't know how many people feel that sometimes when they get an outcome of something that they thought should have been another way, then they get into this mindset that is confused. For me, that is a trigger, and I'm working on it through psychotherapy and obviously from the support system that I have said. Joki from my Facebook page is asking, please discuss depression. Okay, Joki, let me tell you about my depression. I went into my depression at a point where I was the women. And if you were in Nairobi, you realized my absence for close to a year. And when I went into that depression, the issue that took me into the depression, I don't have permission to talk about it, but it was family related, took me to hospital. And I was admitted, I think, for close to a month and a half or two. And I had to be given very serious, medication. So it was a point where nobody could even visit me as per se. And then when I came out of that hospitalization, at that time, I think I believed that should have healed me. It had not. And therefore, I again played around with, should I continue the medication, should I not? I've been in hospital for 1.5 months, I think I'm okay. Again, not really, I wasn't okay. So when I came home, I went into that deep depression because I had stopped taking my medication. Underline that. I had stopped taking my medication, assuming that I could do without it. A very big mistake we make. I repeat, a very big mistake. So I was in my room, not leaving the bed, maybe just to go to the bathroom and back, hardly, and not meaning that I was necessarily going to bath every single day necessarily. I could just not get out. I couldn't think of anything positive. I couldn't feel happy. I had no joy. I normally see my children and I'm very excited. I mean, I love my kids so much. I love my husband, I love my family. But they would walk into the room, look at me, and I would stare back at them. And it's not that I didn't realize how much that was hurting them. I did. I just didn't even have the capacity to even tell them, sorry, I don't know why I'm feeling this way, but I'm just feeling it. And after a long time, again, one day, my sister Betty, who I've spoken about already, walked into the room. I think my parents were also here, I don't remember. She put in the car again and taken back to hospital. And this time, I was able to keep to the regiment. But that whole process I'm telling you about, Njoki, took me close to a year. That is now the depression that worries. One of my friends' homes where I had gone to stay for about 2 weeks. She's a member of Hot Mamas, the group I'm telling you is like my sisters, and it is in her home where I've gone to stay for 2 weeks for work reasons, where I felt almost suicidal, where suicidal thoughts started coming to my head. And how do suicidal thoughts come? They just come because you're not being able to get out of this state. And you're starting to feel guilty about everybody else who is having to be sad about your state. So you're even carrying more guilt than those who are around you. But listen to me clearly. And I want to be very, very clear about this. I was offered help throughout this year. I could have gotten out of this depression, I believe, much earlier if I just had opened up a bit to allowing people into my space and communicating. People tried to come to me, I wouldn't agree. I wouldn't allow. Apart from my family who could come into my house, I wouldn't allow anybody else. I would say I don't want. And because people didn't know what they were dealing with, even my family was in some kind of a crisis, I kept away help. And that's what I regret the most. I regret the most that I took so long to get help. So depression is real, and depression is mostly what would lead you to suicidal thoughts. Okay, I hope I answered you there on depression, and that is why I'm so passionate, more than on the manic, which I will keep talking about as we go on. Depression for me is the real state that I'm finding this country in. Helen, thank you for saying you're proud of it, so thank you. Anyamu, thank you. And yeah, and you're right, when somebody is suffering from bipolar depression, the family suffers too. I agree 100% with you what you said there. Very true, family also suffers. Abiola, thank you very much. Continue raising awareness, Abiola. If you need me to work with you, I will. Abiola says he's also working on raising awareness on mental health and wellness. So I don't even know what I've said and what I've not said. As I said, we are starting this conversation today. In the next episode that I will come with on board, I will make sure I'll have a psychiatrist or a psychotherapist to answer the questions that I'm not able to answer. I just want to say this. Stigma. Let's stop the stigma around mental health. The thing I like talking about bipolar disorder is this, and it is actually bipolar disorder. People with bipolar disorder are geniuses. I like saying that because truly they are. And if you've never Googled bipolar, just do so. Google is your friend. Google bipolar and Google people who have had bipolar, and you'll realize that the great artists, great scientists, great, big ideas, bipolar, when you are at your manic level, you have the greatest ideas. You are able to organize, you are able to do so much. And that's why when you go to depression, people can notice immediately something is very wrong. And people say something is wrong with Shebesh. Because if I'm in a meeting and I have not spoken and I have not brought on board something that is amazing, something is missing from that meeting for those who know me. And maybe that is when I'm sliding back into depression. But I'm telling you that when you manage it, it doesn't take away your capacity for great ideas. Mania is fun. Mania is fun. The point at which you have these great ideas, and the point at which you are very interactive, and the point at which you are on the ground moving things, etc. It's a fun space. That's where everybody would like to be. But with bipolar, it can escalate to carelessness and to things that you do that will ruin you, even your reputation. It can ruin your finances. It can ruin your relationships, because now it has gone to a level that as bipolar you cannot control unless on medication. On the other side of the depression state, which I have said, again, if you recognize it on time, it doesn't need to take you all that time that I'm talking about. It doesn't need to do so. So when you stigmatize a member of your family who has mental health, and you say, "Uyu alirogwa," or you say, "Hey, kwetu kwangi watu wamechizi, so wewe sio wetu," I mean, I've been through all these things. I know. I've also been stigmatized a lot on social media. When somebody takes this conversation and twists it, it hurts somebody with bipolar who is not yet prepared for such things, who hasn't learned to deal with bullying. Cyberbullying disturbed me for a very long time. In fact, around my time of depression, there was a lot of cyberbullying. It affected me greatly. It no longer does, for information. So anybody who is thinking that this is a space for maybe bringing on other issues, please just use my other pages. I mean, use my Twitter and my Facebook to discuss me politically. But on this one, I'm urging you, please, even if you are tempted, don't. Because this platform, I'm hoping all the people who are logging in now will benefit, and they might not be able to understand the comments you make. So please, let's make this page about mental health and no stigmatization. Especially from the family. Especially from the family. The family is so important around a person with mental health issues that stigmatization and feeling of embarrassment and not being able to communicate, that as family, please, let me appeal to you to go out there and support. I also always talk about this. People go to work, big offices, big jobs, small jobs, it doesn't matter, every single day. And I give an example of what we do a lot as people who are politicians or at our levels. We go to funerals. We go to funerals in big ways, as you all know, Kenyans know. And we go in numbers. But when we come back to the office, that colleague who had lost a father or a wife or a mother, etc., you do not realize that they are going through mourning or some kind of a state of such like that. And you come back, you finished with the funeral, the big matanga everybody went for. When you come back, nobody asks that person, how are you doing? Are you okay? We think that as long as we contributed to the funeral and we went to the matanga, that was it. And that's an example I can take from when I lost my dad. It took me a while to understand why are people not asking me how I'm doing, yet they all came for the funeral, they came for the matangas, it was a big funeral. But then after that, it was me and my family. We were again struggling now with mourning a man who was so dear and great to us, and it's something everybody does. So in one day, in your office, in your workplace, wherever you are, anybody you think doesn't have to have lost somebody, maybe is struggling, etc., you will notice something different in a friend. You will notice something different in a family. Please take time to just ask, how are you doing? Are you okay? You will be shocked that somebody can just, burst into tears, and you will wonder what I just asked you how you are. That's the question they've been waiting for. That's the question they've been waiting for. Oh, Fatuma, you are asking what's the difference between bipolar 1 and bipolar 2. I told you I'll come with a psychiatrist in my next to tell you, but what I know about bipolar 2, which I am, is that when you go into one state for a prolonged period of time, which I did with my depression, therefore bipolar 2. Bipolar 1 doesn't have a very long cycle of both. They are shorter, but I'm not the expert, I'll get an expert. Thank you, my sister Marian, love you, love you, love you. Constance, can grief and the feeling of always wanting to be alone be a sign of negative mental health? Oh, depression is about being alone. Depression is about not wanting anybody near you, not being able. But let me tell you what I have learned through my psychotherapy, and who was this again? Constance. Constance, I take alone time these days. Something I have learned. Because of my bipolar and trying to be busy and trying to be in everybody's life and not wanting anybody to miss me from their functions, because how will they take it? I never took time for myself, yet I need it. Because with bipolar, you have rapid cycling of thoughts, as I've told you. So being alone and wanting to take time to be on your own is not a negative. It is only a negative if you're in depression. And so I don't know, Constance, whether it's at which time you're asking, but if you're depressed, being alone and not wanting to see anybody and not being able to get up like I've explained, that's a critical problem. But like now when I'm taking care of my bipolar, I've told you I'm on medication and I'm on psychotherapy, in a day, and I don't mean sleeping, in a day, at around 1, 2, 3, somewhere, I take time alone. Even if I'm in a function, a big function, I go into my car. I go into my car and either listen to music, or I close my eyes, or I take deep breaths, because it helps me manage myself. So I hope, Constance, I've answered you, and if I haven't, as I said, I'll have an expert to come answer you. Lucy. Oh, Lucy, thank you saying you're listening to me. Continue listening. Thank you. I think I want to close on the stigma issue and to ask those of us who stigmatize people with bipolar, please stop. Those of us who stigmatize people with mental health, please stop. Please remember I have said that this is a disease like any other disease. I think I have opened up a platform, this platform. Next time I am here, I will not be alone. I just wanted today to speak to you, Kenyans, that mental health is real. We are going through Corona, COVID-19, third wave. If you are like me, who has gotten COVID, and everybody around me has gotten COVID, I was already carrying guilt, huge guilt, thinking if it was not for me doing my work, especially on FGM, which I'm very passionate about, and taking my staff all over the country. 1 minute we're in West Pokot, the other day we are in Samburu, etc. We would be on the road for a month on FGM because the president is committed to that. When we all got COVID, it took me a while to get over the guilt. But now that I have the tools to deal with a trigger like guilt, it didn't take me down. COVID is coming with a lot of stigmatization, which worries me. People don't want to say they have COVID. I don't know why. But when I think about it, I truly believe it's because of the way people are reacting to you when you say you've had COVID. Stigma, even around other diseases, HIV stigma was such a big thing. Today, having HIV is not as stigmatized as it was in the beginning. I was talking to my colleague Kas Mwangangi of health and asking her, beyond treating people for COVID, how are you treating people for the mental health issues that will come up because somebody has COVID, who now doesn't know whether they'll make it or not, or their family? There must be a mental health, a component to how we are dealing with COVID. And she agrees with me 100%, and I think they are already working on that. My colleague Kas Nadia from the youth docket has introduced mental health to a program that she's doing. In fact, that's where I started my conversation with Isiolo. The program is Kenya Nimimi, and she has a mental health component on it. Parents like me, and grandparents, because I'm also one, our children are going through a lot which we have no idea about. And I don't know whether we have no idea about it because we don't understand it, we don't want to take time to understand it, or we think they are misbehaving, and always in trouble. Children are acting out. I think they are calling out to us for help. Children, young people these days, through these social media platforms, are being influenced in ways and manners you have absolutely no idea. It's time we started thinking about the mental health of our children. It's time we took that space and time that we are told every other time, do you know what your child is doing? When was the last time you had a conversation with your child? And I'm saying this knowing I was one of the parents who didn't interact enough to understand my children and where they are. Bipolar, by the way, and many mental health diseases are also inherently genetic. So my family, my children, have a great, the most likely can have mental health issues. And so when you don't have that knowledge and you don't go out and look for it, the young people will not come to you because they may be enjoying the high of bipolar, but the day they hit the depression, then that's where we are getting issues, and that's where we are getting cases of suicide. And that is why the president even spoke about it. I remember it was a national day, I just don't remember which national day, where the president had to speak about suicide rates in this country. Because we can love our children, which we all do, and give them as much as we can. And be happy that they are going out there, taking their time, probably trying this, trying the other. We have a problem with our youth. They think if they start a business today, by tomorrow they are not making millions, they are failures. We know that's not true, but that is the generation in which they are living. We need to interact with our children. We need to know what our children are thinking. We need to know what the young people of this country are thinking in order to stem the suicide rates that we are seeing. But we've also seen suicide with adults. We've seen violence coming with adults. COVID opened for us in our ministry numbers of gender-based violence that we could not understand. And I believe that is still a component of not being able to deal with mental health issues and emotions within the family. Oh, I'm being told to remind you to please subscribe to my YouTube channel, Rachel Shebesh, Mama Nai, Jenga Nai. And as I conclude, let me look at a few more people. Thank you for doing this. Thank you. I will continue doing it. Doris, much needed subject to be addressed in our society. That's why I'm doing it. And just to remind you that I have said this platform is for you. I will be more structured and focused when we come back. We will take item to item. I think that would be fair. One day we discussed mania and we really get into mania so that you understand it. The other day we get into depression and then triggers, which is very important. I was given a book by my psychotherapist. Another thing I did not know I was, but I had heard people talking about it. Don't know whether you can see it here. Yeah. That's the book. It's called Codependent No More. How to Stop Controlling Others and Start Caring for Yourself. This is a book that I am reading already. The few pages I've read, I recognize myself so much. Around me, there is a tendency for taking care of everybody and forgetting myself. That's why I'm reading this book. That's why my psychologist told me to read it. So there are so many things that stem out of mental health. But let me conclude by saying this. We are okay. We are okay. Totally okay. Look at me as an example, and I hope I'll be able to bring colleagues of mine who will discuss this. I'm hoping soon to bring Cousin Nadia, who also has a mental health issue, which that is why she's also passionate. I'm looking at celebrities who have spoken to me before, journalists when they've interviewed me. Some of them have come and asked me questions. I'm hoping to bring government here to speak to you about mental health. So as you subscribe and ask others to subscribe, please also suggest what it is in mental health you would like to discuss, because bipolar disorder is just one of the many mental health. We are okay. You can beat this. You can beat this. We are okay. God bless you. See you in the next show.